So, the peripheral nervous system consists of the 12 pairs of cranial nerves and 31 pairs of spinal nerves. So, the nerve fibers which arises from the brain, that is cranial nerves, the nerves which arises from the spinal cord, they are the spinal nerves. That means the nuclei present in the brain and spinal cord. So the origin from the brain, there are 12 pairs of cranial nerves. From the spinal cord, the 31 spinal nerves. Now today we will discuss the cranial nerves details. So what is the main function of this cranial nerves? So usually the cranial nerves are under the different functional concepts. For example, some of the cranial nerves are purely sensory functions. They carry the only sensory information towards the center. And some of the nerves, they are motor. They transmit the impulses from the brain to the peripheral, central nervous system to the peripheral. Then some of the nerves are both functions, that is transmissions of the sensory impulses and as well as motor impulses. Then another one is the autonomic. Some of the cranial nerves involved in the autonomic nervous system. So here the different functional concepts. Some of the nerves are sensory concepts, some of the nerves are motor, and some of the nerves are both sensory and as well as motor, and some of the nerves are involvement in the autonomic nervous system. That is the main functional concept of this cranial nerves. So what are the nerves? The cranial nerves. So the first nerve is olfactory nerve, second is optic, then third oculomotor, then fourth trochlear, fifth trigeminal, sixth abducens, seventh facial, eighth vestibulocochlear, ninth Glossopharyngeal, 10th vagus, and 11th accessory, 12th is hypoglossal. So these are the 12 cranial nerves. So for mnemonics, for remembering of this, that is one of our trained teacher asked for a good vehicle and horse. The first letter of this, that will be indicates the cranial nerve name. So here the third cranial, fourth cranial and sixth cranial nerves. So these particularly the three nerves are extraocular nerves because these nerves are innervated to the extraocular muscles. That is a totally extraocular muscles. 6, that is the innervations mainly into the extraocular muscles. So these particular three nerves are extraocular nerves. So that is the one point we have to be remembered. So for the mnemonics, for remembering, one of our trained teacher asked for a good vehicle and horse. That is first letter of this word indicates and remembering of the cranial nerves. So here the nerves which are sensory, which are motor and which are both, that is the concept. So usually The first cranial nerve, second cranial nerve, sensory function. Then third, fourth, motor components. Then fifth is both. The sixth is motor component. Then seventh is both. Eighth is again sensory component. Ninth is both. 10th is both. 11th and 12th motor component. So for this remembering, we can remember some says marry money, but my brother says bad business, marry money. So the word which starts from the S, that is sensory. The word which starts from the M, motor. The word which starts from the B, that is both. So that is the component of cranial nerve function. So sensory, purely they have a sensory function. Motor, they have purely motor function, and some are both, they have a component of sensory and as well as motor. So that is the point, you have to make it clearance of this. So first, second sensory, third, fourth motor, fifth is both component, sixth is motor, seventh is both, eighth is again sensory, 9 and 10 both component, 11 and 12 motor component. That is the point you have to be make it clear. Then again, so the nucleus of the cranial nerves. So it is a simple where these nucleuses are located, the lies. So the location of this cranial nerves, the simple understanding, first two, that is olfactory and optic cranial nerve nuclei are located in the forebrain. That means the centers, the nucleus center that located in the forebrain, that is olfactory and optic. Then oculomotor, trochlear nucleus are located in the midbrain. Then fourth, fifth, sixth, seventh, fourth is small portion, mainly 5, 6, 7, 8. These nucleuses are located in the pons. Then 9, 10, 11, 12 nucleuses are located in the medulla oblongata. So simple formula, 2 plus 2, 4 plus 4. The nucleuses of the cranial nerves, simple, 2, first 2 nerves, nucleus in the forebrain, next 2, that is 3 and 4, that is in the midbrain, then 5, 6, 7, 8, that nucleuses are in the pons, and 9, 10, 11, 12, that located in the medulla oblongata. So these are the nucleuses of cranial nerves. They are located in the different part of the brain. So simply, you will remember the formula 2 plus 2 plus 4 plus 4 from 1 to 12 cranial nerves. So these cranial nerve nucleuses in the brain, and these nerves are emerging, that means coming out from the cranial cavity to the different organs through a different phenomena from the cranial cavity. The all cranial nerves, they come out from the cranial cavity to the particular organs, viscera, they passes through the different phenomena. Say for example, this olfactory nerve, they will come to the olfactory phenomena, that will be the in the mucosal layer, roof of the nasal cavity, like that. So they will be transmit through a different phenomena and reaches to the particular organs. So here all that is bottom, that is surface of the brain and brain stem, and exit the skull through various foramina to reach their targets. All the cranial nerves, they exit from the bottom surface of the brain, that is the base of the brain. All the nerves which are emerging from the cranial cavity through the different foramina at the bottom surface of the brain, and they reaches to the targets, that means to particular organs. So that is the point, and simply it can be understood the brief functional concept. So what about the first nerve, that is olfactory, that mainly related to the smell. Then optic, that related to the vision. Then third, fourth, sixth. So these are mainly innervated to the eyeball muscles, and these have a function of movement of the eye. Then fifth nerve, that is facial sensation, that is the trigeminal nerve, the facial sensation by a trigeminal nerve. Then seventh one, that is the facial movement. The facial movement means, for example, smiling, speech, or facial expression. So that is the facial movement means in the facial muscles movement. That is the mainly related to the facial nerve. That is nothing but smile, or we can go for the some smile face, or some there is a facial expressions in a different aspect. That is facial movement by facial nerve. Then the eighth, that is vestibulocochlear, that is hearing and as well as balancing, the body balance, and as well as hearing nerve, that is auditory nerve simply, or vestibulocochlear nerves, you can take it up. Then ninth is, that is mainly innervated to the organs and as well as the taste, that is the nerve which will be related to the organs means, that is organs of the thoracic region, organs of the neck region, and as well as to the tongue, sensory component, and so then tenth is also same, that is the vagus nerve which will be located in the thorax organs and taste and abdominal organs and some of the pelvic organs. That is mainly the component of main organs of the thorax region, abdominal region, and pelvic region. Then 11th, that is accessory nerve, that is mainly related to the portion of the shoulder region, shoulder upward movement, down movement, and the turning of the head. So in related to the muscular movements, particularly in the shoulder region and head turning region, that is usually accessory nerve. Then the 12th cranial nerve, hypoglossal, that is mainly in related to the tongue movement. So that tongue movement mainly in related to the hypoglossal nerve. It's a brief functional concept of the each cranial nerve. Basically, if you know these things, then we can expand and go for details of the functional concept of the cranial nerves. So all the cranial nerves, almost they will be at the base of the brain. They will be come out and reaches their respective organs almost attached to the base of the brain. So we can see the first nerve, that is olfactory nerve, that is related to the base of the brain at the frontal lobe region. Then next to that, the optic nerve, that is from the two eyes, that is second cranial nerve. Then they crosses and forms as optic chiasma, then optic tract, then reached to the geniculate body. That is the course of the things. Then similarly, the third cranial nerve, that is oculomotor, then fourth cranial nerve, that is the trochlear, and sixth cranial nerve, that is abducens, that is junction of the pons and medulla, that is the abducens, and in the region of the pons, and that is the portion third and fourth cranial nerve, they are mainly related to the eyeball movement. They supplies to the extraocular muscles. So then the fifth, that is the trigeminal, that is also in between the midbrain and the pons, that's coming out. Then seventh, that is the facial nerve. Then eighth, vestibulocochlear nerve. They coming out just at the junction of the pons and the medulla region. Then again the ninth and the 10th, they comes deep to the medulla, and the 11th and the 12th. That 12th is mainly in between the pons region, that is the anterior portion, that is pyramid, in between the pyramid and the lateral portion of the medulla, that is emerging the 12th cranial nerve. Then 11th cranial nerve is also emerges deeper to the medulla oblongata. Almost all the cranial nerves, they attached to the base of the brain, and they will be coming out and passes through their respective foramina and reaches to the target organ, that is the position of the cranial nerve location. So usually we can have a trick. What is that? Say for example, how many nose? Only one nose we have. One. What is that? First. What is that first? Olfactory. That means the first is olfactory. That is how many nose? One nose. The one nose is indicates the nerve innervation of the nasal mucosa, that is olfactory nerve, that is the first nerve. Then we'll come to the second, two eyes. What is the two eyes? Second cranial nerve. What is the second cranial nerve? That is optic nerve. That is the identical point. Then 3, 4, 6 makes your eye tricks. Eye tricks means that is the movement of the eye or any of the tricks, that is looking round, upward movement, down movement, medial, lateral, any of that movement of the eyeball. So that is related to the third cranial, fourth cranial, sixth cranial nerve. That is one formula, LR6, SO4, rest 3. That means LR6 means that is lateral rectus. L lateral or rectus. So lateral rectus is innervated by sixth nerve, that is abducens. Then superior oblique nerve, that is superior oblique muscle, that innervated by the fourth nerve, that is a trochlear nerve, and remaining four muscles, they are from third cranial nerve. That remaining four means inferior oblique, medial rectus, superior rectus, inferior rectus. So just it is simple formula to remembering the innervation of the nerves to the eyeball muscles. Then fifth, realms with trigeminal. So trigeminal means there is a facial sensation. So make a realms. So then the seventh, across your face, facial region. Seven, you can make it the forehead straight and coming down. So that facial expression, that is in the innervation of seventh cranial nerve, that is the facial nerve. Then eighth, we can put in the ear, that is auditory nerve or vestibulocochlear nerve, that is related to the ear, that is hearing and balancing nerve. Then 9 and 10, below your chin, that is glossopharyngeal and vagus nerve, that is mainly the cervical organs and the thoracic organs and abdominal organs, that is ninth and 10th. Most of that organs of the neck region, then thorax region and abdominal region organs are mainly innervated by the two important nerves, that is glossopharyngeal and the vagus nerve. Then the one on each shoulder, that is the 11th nerve. You can put one on one side of the shoulder and other one another side. So that 11th is mainly related to the shoulder movement and as well as the turning of the head. The shoulder raising upwards, downwards, or the shoulder movement and including the turning of the head region, that is mainly 11th cranial nerve innervations of that particular muscles. Then again the hypoglossal, that is the tongue movement. So the extrinsic muscles of the tongue and the particularly movement. So that innervation of the tongue muscles, that is hypoglossal nerve, that is put on tongue. So 12th is just you can put on the tongue. So this is just a simple remembering point for the where these nerves are innervation or where they have a distribution of that of the particular nerve. So this is the simple identical point of the related of the cranial nerves. So this cranial nerves, the innervation and the function and of the